Hi, my name is Kara Nicolaitis, and I'm a fourth year medical student at Wayne State University. Today, I'll be presenting my quality improvement project, which is titled Optimizing Inventory Management in the Anesthesia Supply Room. This project was conducted at the Children's Hospital of Michigan Department of Pediatric Anesthesiology. To give you some background about the project, anesthesia providers require hundreds of supplies to care for patients every day, and product shortages have been shown in the literature to lead to delays in care, use of substandard products, and increased rates of medical errors. Therefore, it's of utmost importance that institutional protocols surrounding inventory management be optimized to ensure an optimal level of inventory to support ongoing patient care. To give you some background about how inventory management works in our department, anesthesia supplies are stored in a dedicated room nearby the operating rooms where they're stored in labeled bins. There are two categories of items: standard items and special items. Standard items are stocked daily by Owens and Minor, which is a national healthcare supply distribution company, based on a par level that was informed by prior inventory usage. On the other hand, special ordered items are not automatically delivered and must be manually reordered by one of the anesthesia technicians who are extremely short staffed. Hospital leadership must then approve order requests before they are placed to suppliers. Now I'd like to draw your attention to Figure 1. This is a fishbone diagram depicting causes thought to contribute to supply inaccessibility at CHM. As you can see, there are numerous causes thought to contribute to this issue at multiple levels of the supply chain. Now to talk about the objectives. Briefly, our goal of this project is to decrease anesthesia supply shortage at the Children's Hospital by optimizing our existing protocols surrounding inventory management. We will assess our progress in this area using multiple choice surveys sent to anesthesia providers in the department before and after our interventions have been implemented. Next, moving into our methods. In January of 2022, we sent pre-intervention surveys to all anesthesia providers at CHM. This consisted of multiple choice questions pertaining to supply room shortage and organization. In early February 22 is when we implemented our interventions. These included decluttering the supply room and adding color-coded labels to bins, modifying par levels based on item usage, identifying backup suppliers, converting many special items to standard items, and requesting automated weekly emails from suppliers regarding the status of backordered items. Finally, in late February 22, we sent mid-intervention surveys to all anesthesia providers at CHM, again containing the same questions in the pre-intervention survey. Now I'd like to draw your attention to Figure 2. This is a diagram that demonstrates all of the questions and responses that we included in our surveys, and it also includes the results that we obtained. The first column illustrates the multiple choice questions and responses that we included in our surveys. I won't read you all of the questions, but I do want to point out our scoring schematic that we used for the answer choices. Every multiple choice question was associated with 5 possible multiple choice answers, each of which was assigned a point value based on the severity of the issue at hand. For example, for question 1, how would you rate the severity of the supply shortage in the anesthesia supply room? A provider could rate this not an issue, which would be assigned 1 point, to severe issue, which was rated 5 points. And scores that are larger would be associated with a greater severity of the issue in question. And we maintain the scoring schematic throughout all of our questions to allow for data analysis at the end. Columns 2 and 3 depict our pre and mid intervention mean scores. Column 4 indicates the delta in our mean scores between the pre and mid intervention surveys. And finally, column 5 indicates the p-value obtained from conducting a paired two-tailed t-test between participants who completed both our pre and mid intervention surveys for determining statistical significance. Now to go to data analysis. We received 25 responses to our pre-intervention survey and 27 to our mid-intervention survey. And thus far, we've seen statistically significant improvement in the following categories: organization of the supply room, frequency of needed supplies not being stocked in the operating rooms, and frequency of delays in OR turnaround time secondary to supply shortages. The following items did not demonstrate improvement: perceived severity of the supply shortage in the supply room, perceived severity of the supply shortage in general, and frequency of needed supplies not being stocked in the supply room. Now for our conclusions. Based on our results thus far, our strategy of color coding labels and decluttering items in the supply room was an effective strategy for improving organization. We also noted a concomitant improvement in OR turnaround time delays, as well as items being stocked more consistently in the OR, suggesting that improving the organization in the supply room improved supply accessibility. However, we still are struggling with supply shortages, and we attribute this to continued supplier shortages due to COVID-19. But we also feel that we have additional work to do in terms of further modifying par levels, identifying more backup suppliers, and converting more special items to standard items. We are also looking to hire more technicians to assist in these interventions, as we're currently very short staffed. Finally, we would also like to shorten the approval process that must occur through CHM leadership before orders can be placed to manufacturers. That concludes our presentation. Please let me know if you have any questions. Thank you so much for your time.